Hello friends, welcome back to my YouTube channel Medifirst Academy. Today I am going to explain about HAS BLED scoring system. Here I would like to talk with you regarding what is this HAS BLED scoring system, where to use it, when to use it, and what is the benefit of using this scoring system, and how you going to optimize the modifiable risk factors and reduce the bleeding intensity in your patient. If you haven't subscribed my YouTube channel, please go and subscribe and like it. Let's move into the topic HAS BLED scoring system. This scoring system is standing to determine and assessing the bleeding risk in your patient. Sometime for medical purposes, medical condition, you have to think about to start the anticoagulant or antiplatelet for such a patient. As example, suppose you have diagnosed the newly onset non-valvular AF patient after your acute management over. Prior to discharge, you have to calculate your Chatwasco scoring system and get the score of that particular patient and decide to anticoagulant. If your Chatwasco scoring system for the particular patient is more than 2, you have to consider to start the anticoagulant and reduce the stroke annual risk factors in your 12-month of period. I have discussed it in a separate video, and if you did not see it, please go and see that my Chatwasco scoring system, how it used and when it used. Then you will be identify what is that and how it's important. Here I'm going to explain you regarding the anticoagulant in briefly, how it's going to work in our body. Anticoagulant is a preventer of forming the clots. Actually, if you give your anticoagulant to your patient, it can prevent the formation of clot in your blood vessels. So how it's going to be work, it can suppress in the synthesis or function of the various clotting factors that are normally present in our blood. As a result, it can suppress our cascade coagulants cascade, and as consequences it can increase the bleeding risk in our body. I'm not going to give you in detail regarding how this anticoagulant is going to be work in this video, but I would like to upload another video regarding how your warfarin mechanism of action in the next video. So I would like to invite you all guys to see that video also, then you will be get the idea how this anticoagulant is working in your body. So if you have system to identify prior to start your anticoagulant your patient's bleeding intensity risk, that would be grateful. Due to this reason, this HAS BLED scoring system is established. HAS BLED scoring system is assessing the 1 year major bleeding in your patient who is going to start or anticoagulant or who is almost in the anticoagulant. What is this major bleeding? Actually, major bleeding is a term we can consider if the ICH, risk of drop in HB by 2 gram per deciliter risk, and increase in the possibility of blood transfusion. Those are we consider as major bleeding events. So in the HAS BLED scoring system, actually this is a mnemonic of bunch of letters, and we call it as mnemonic, and these letters, each letter representing the different character and different component in our mnemonic. So H standing for the hypertension. Here your patient blood pressure, systolic blood pressure, if it is more than 160, you have to allocate that particular comorbidity for the 1 point. A standing for the abnormal renal or abnormal liver function. Here you have to remember this A is standing for abnormal renal or abnormal liver function. Right? So if your patient having only abnormal renal issue, then you can give the 1 point in here. If your patient having only abnormal liver function problem, then you have to give the 1 point in here. If your patient have has a both abnormal and liver function, then you have to give the 2 point in this particular component. So what, how you going to define this patient has abnormal function, liver function, no abnormal renal function? I'm going to show you in this slide. Actually, you can say this patient having abnormal renal function if the patient is almost on hemodialysis. Yes, you can say it. If your patient has undergone for a renal transplantation, yes, definitely that is a abnormal renal function. Then if your patient baseline serum creatinine is more than 2.26 milligram per deciliter or more than 200 micromillimeter per liter, yes, you can say that patient having abnormal renal function. Right? Then how you going to determine the abnormal liver function means if your patient bilirubin is more than 2 times its normal level, yes, indeedly. Then if your patient AST, ALT, and alkaline phosphatase is more than 3 times in the normal, you have to consider the abnormal liver function. If your patient almost diagnosed patient cirrhosis, yes, you have to consider that the abnormal renal liver function. Then suppose, as I told you, if your patient only have abnormal renal function or abnormal liver function, then you have to give 1 point. If your patient has both renal and liver function, then you have to go 2 point for the year. So S standing for the previous history of stroke. If you have your patient have previous history of stroke, then you have to give the 1 point here. B is bleeding and 1 point here, and L for the labile INR. Labile INR means that the INR is not going to static. It can be no high, it can be low. Due to that particular patient, you have to give that component another point, 1 point. E standing for the elderly or age more than 65 years old, then you have to consider to give 1 point for that particular category. Then D component contain the two category. One is drugs category, another one is alcohol. If your patient is almost on antiplatelet, anticoagulant, or NSAID, you have to consider that one also risk factor to develop the bleeding intensity. Then you have to give the 1 point for that particular drugs category. On top of that, your patient almost taking alcohol, is a regular alcohol consumption patient, then you have to consider to give 1 point for that particular risk factors. Then you totally you can gain from this D component 2 point. Maximum in the HAS BLED scoring system you can gain 10 score, so 9 score, right? Then how you going to determine this patient has a high risk of bleeding intensity? If your total number of score you are going to gain from your patient, if it is more than 3 or equal to 3, we consider a high risk patient, right? If your HAS BLED score is less than 3, we call it as a mild risk patient for the bleeding intensity, right? So I just want to ask from one question from you. If your suppose your patient HAS BLED score is more than 3, does it mean starting anticoagulant is contraindicated? Answer is no, right? Because this HAS BLED scoring system, once you calculate and once you get your patient's value, from that you can get the holistic idea about the bleeding intensity which can develop in your patient. Then if your patient score is more than 3, you would have to regular follow up that patient in the medical clinic and try to optimize the modifiable complication. Suppose now your patient is a hypertensive patient, you try to keep your BP in the normal range, right? Then it will be automatically reducing the HAS BLED scoring system by 1, right? If your patient BP is normal, then you don't want that much worry. Then it will automatically reduce your HAS BLED scoring system also, score also, right? Suppose your patient is almost taking your alcohol consumption, then you have to advise your patient to don't drink, because we are going to start anticoagulant. Since you are on the anticoagulant, it will increase the bleeding risk. On top of that, if you take more alcohol, it can double the chance. So you have to control your taking an alcohol consumption also. You have to address that patient in your clinic. If suppose your patient is taking the chronically inside to the some kind of chronic pain, then you have to advise your patient to do not take that much that drugs, because it can increase your bleeding intensity on top of what we are giving the anticoagulant. So those how you are going to assess this patient in your clinic and optimize the modifiable um, risk factors and reduce, try to bring down your HAS BLED scoring system less than 3, right? So very important scoring system. You when you going to you utilize your chat scoring system for the consider restart to anticoagulant, same as I would like to suggest to apply this HAS BLED scoring system and get your basic um, idea about the bleeding intensity in that particular patient and try to optimize his medical condition and try to modify his modifiable risk factors and start with anticoagulant. That's what I just want to explain you from this video. I hope you guys enjoy it. If you like my video, please subscribe my channel and like the video. Thank you for watching. See you all in next time in my next video.